Welcome to In the ED Now, a podcast that makes you an excellent emergency department physical therapist. I'm Dr. Rebecca Griffith, the ED DPT, and I'm so happy to have with us today Dr. Meredith Grossman. Welcome to the show.
Thank you so much for having me. I'm excited to be on.
I'm so happy to have you here for a variety of reasons, but just so people know a little bit about who you are and what you do, you're not an emergency department PT.
Correct. I am not, nor have I ever interacted with one. We don't have them at my hospital.
We could happily help you fix that, should you want to put us in contact with people to do that. But tell people about who you are and what you do so they understand why you're on this podcast today.
Great. Like you said, my name is Meredith. I have been a physical therapist for 4 years. I work in an outpatient hospital-based setting. And in the last few years, I have really taken on learning about burnout and creating content about burnout, educating about burnout. And I think burnout is something that certainly no one is exempt from it, or no aspect of our field is exempt from it. So I think certainly physical therapists in the emergency department, just like any physical therapist, can benefit from understanding burnout and specifically how it affects their experience of work.
Yeah, I'm pretty passionate about burnout as well because it was something that I think like really affected a lot of us, especially during the pandemic and working in a hospital. And I could just see some of the staff around me just like suffering. Some of them were new grads that didn't get any mentorship because there just wasn't any space or time for that. And so they went from brand new out of the box to run into the ground very quickly. Others of us have just been doing this for so long, it just started to feel tedious and unexpected. And that whole you signed up for this concept is really unfair, I think. And then for me also, I felt like I hit a turning point when my youngest child was really old enough to be about to go to school full time. And then I was like, wait a minute. Like, I was like opening my eyes and looking around me, and I'm like, what am I going to do with my career now that I can maybe divert some more attention to it? So that was when I realized that I had been proceeding in a certain way because that was what my life required. And then once my life no longer required that, it was like, am I happy with what I am doing or not? So I can't wait to hear what you have to say about burnout. How did you get started with this?
So I started my career actually at the beginning of the pandemic. So early 2020 was when I started practicing. And at that time I was working in an inpatient rehab hospital. And so we never stopped working. Like we saw people all through the pandemic. And long story short, in that setting, I think there were a variety of factors that were involved with it. Part of it just being the sort of lack of awareness and lack of preparation, lack of mentorship that was available. And the pandemic certainly didn't help with that, with the availability of mentorship. But yeah, I burned out pretty quickly in that job. And a lot of the people around me were burning out as well. And our management knew that and was aware of it. And including as we transitioned out of the pandemic, or the pandemic restrictions loosened, that we were still having this issue. But no one seemed to really know what to do about it or what to do with the knowledge that people were burnt out. And as I left that job, it was too much. I ended up leaving that job. But in that space, or in that transition, I was left with just this question of what is really going on with healthcare burnout, and what are we not doing about it that we could be doing as organizations, as individuals. And yeah, it was just the fact of starting my career and being thrown off by the reality of working in healthcare and the reality of experiencing burnout, and wanting to understand it better for myself. And then eventually wanting to share that with the people around me, who I felt like, of course, that we could all benefit from it.
Yeah, I think one of the biggest passions that I have is for a physical therapist to practice at the top of their scope and to be less limited by where we work and less siloed into what kind of physical therapist we are. But I think no matter who you are, you've probably had some component of burnout. And one of the things that resonated really deeply with me when I was looking into burnout was that it's not your fault. And I feel like there's this component that we all feel that like burnout is somehow our fault. We're not doing it right. We don't care enough. We're not developing ourselves. We're selfish. We're just not giving our all, like whatever it is. So what would you say to somebody who like really truly is listening and they're like, God, I'm so burned out and I feel like it's my fault. I'm not doing enough.
Yeah, I think that the first thing that I would say is burnout is primarily not an individual issue. So research shows that something like 90% of burnout in the workforce can be accountable or accounted for by organizational factors or more systemic factors. I don't want people to think there is nothing they can do about burnout, but it is absolutely not your fault or your something that you are doing wrong, or the fact that you're not enough or you don't belong in this field. I
Yes.
think that that's something that people feel is what I care about and my values and my emotional state or whatever. I don't belong here. And oftentimes those are some of truly the most empathetic and most caring providers. And I think I would just encourage them to consider the fact that maybe you absolutely belong here, and what you maybe need is just to figure out how to make it how you belong here, or how you can put that into practice.
Yeah, because I feel like one of the first things that happens to people when they say to somebody, "Oh my gosh, I feel so burned out," is the response they're met with is, "How's your self-care?" You really have to prioritize your self-care, which then makes it about you again. And it's your fault. You're not doing enough yoga, or you didn't sleep enough, or you're like, but I tell you what, one of the components of burnout for me, it has to do with moral injury when I'm trying to provide care for a patient in the emergency department and I cannot get them what they need. I
Right.
know what they need. I know exactly how to help them. And I can't get them what they need because of societal factors, because of systemic factors. We have payer-centered care, not patient-centered care. So one thing that keeps me up at night is that component. But sure, maybe I just need to sleep more.
Absolutely. I think there is a huge problem of oversimplifying the problem,
Yes.
and particularly making it about an individual's health practices or health behaviors. That, and especially when I was experiencing it myself, I was like, that answer just felt so incomplete to me. And I was like, yes, but what about all these other things? How are we supposed to navigate all of these other things, like moral injury, like having someone in front of you who doesn't have a house to go back to, and you're trying to give them physical therapy, or you're trying to work on medication compliance or something like that? It's, yeah, these are issues that really weigh on us as healthcare providers and that are unique to our field. And I think that very much needs to be centered in the burnout conversation, is how, as not only as an individual, how do we work with those situations, but also as organizations, how do we support patients in those situations? How do we support the relationship of the patient and provider in that context?
What are some of the factors that you're talking about that are like institutional factors? Because I can think of a few, but since you've done the research, what are some things that really have come up consistently?
Yeah. So things that are associated with more burnout, things that we would expect: longer shifts, the perception of short staffing, a perceived lack of support from management. I think a big thing that comes up a lot in research is just like your relationship to your direct superior is extremely relevant to your experience of burnout. If you feel like you have someone who, has the same interests as you and has your interests in mind, has your patient's interests in mind, that can really be really supportive when you're in those situations with patients that are really emotionally challenging or ethically challenging. Just feeling like you're not alone in it, and that you're not fighting your boss or your employer along with the person's lack of housing.
Yes. Okay, that makes a lot of sense. What are some of like risk factors for burnout? Because I feel I say we've all probably been there, but there are probably some people who haven't yet. And so, what are some risk factors? Are they modifiable? Are they not modifiable?
So, most of the risk factors, in my interpretation of the research, the most consistent information comes out about organizational factors, like risk
Yeah.
factors. And specifically, and I should say with that too, not necessarily the full organization, but like unit based. So, like someone or within a work team, my experience as an outpatient therapist in this hospital could be very drastically different, and the organizational factors could feel drastically different than someone working in the acute section, because we have different bosses and we have different systems. And so I think that's, I say that mostly because if someone is in a big organization and they just feel if something's not working for them in their environment, it may be the case that being on a different team or in a different section of that organization might be a very different experience. But other than organizational factors, some things that show up are like younger career providers seem to be more susceptible to burnout. Other than that, there's some kind of hypothesizing about people who come in with certain expectations or people who have a more idealistic view of what healthcare is going to look like. But that's a little bit murky research. I would say that doesn't really
Sure.
stand up. So yeah, most of it is not, again, most of it is not you. You're really not the problem here.
Why is it that younger professionals are a little more predisposed?
I think one thought that I have about that is honestly that it's self-selecting because people who truly burn out and are done are not going to make it to that. If you're assessing, people who have been in the field for 20 years, you're not getting the people that 20 years ago were in the field and left because they were burnt out. So I think that there's some like self-selection that's happening there. And the other researchers hypothesize that it's you at just with experience and feeling like you're more of an expert in your practice with experience, feeling like you're ineffective is part of the burnout experience for a lot of people. And it seems that perhaps earlier career providers are more likely to get bogged down in a lack of confidence and that
Hmm.
that sense of they're not good enough or they're not effective enough compared to people who perhaps have just developed more solid footing under their practice.
Yeah, I would think to a certain extent, I feel like healthcare's changed in the last 10 years as well. I've only been a physical therapist for 16 years, but I feel like it's changed a lot in that time period as well. I feel like there are some components of healthcare in general that are just a lot more toxic than they used to be. So that would be my 2 cents that I would throw in the middle of that. Is that things have not changed necessarily in a super great way, particularly in a way that maybe benefits physical therapists or our patients. So I would think maybe that might be a little part of that is, but that just makes me really sad.
Yeah, it's a really big problem, honestly. And I think that
Yeah.
is exactly why it's so important for burnout to be talked about with a wide lens
Yeah.
and with this perspective of the way that healthcare is evolving and how that contributes or helps provider burnout rather than just focusing on let's get people exercising, let's get sleep better. That stuff is important. It's a piece of the puzzle for an individual's energy and well-being and all those things, but it is not a complete solution by any sense, especially when we have a healthcare system that seems to be moving in a direction that is, as you said, less patient-centered and less provider friendly.
Yeah. I had a coworker who was a nurse who went on a long vacation because he was burned out. So I'm going to go on a vacation. And obviously, because we're told self-care will fix it, he was just sure that when he came back, it would be fine. He just needed a break. But as soon as he came back, I said, "Hey, like, how is everything going?" He's, "Oh, it's fine. This is going to be my last week." And I said, what do you mean? What are you going to do? He said, "I'm not going to be a nurse anymore." And I said, "Why? What are you going to do?" And he was like, "Medical device sales or something like that." And I said, "Why would you do that?" And he said, "Because I'm so burned out, I will hurt someone.
Wow.
And I know that now, and I have to go before I hurt someone or hurt myself." And to me, maybe that's past the point of just like burnout and maybe into some more serious mental health issues for this individual. But I want to know how we can like help identify burnout in others, but in a supportive and non-judgmental way, and help them then navigate burnout or help us navigate ourselves, right? So if you're listening to this and you're like, I feel like that, I feel like I'm going to hurt somebody. Not intentionally. He didn't feel like he would intentionally hurt someone. He just felt like he was going to make an error that would cause harm. And as a nurse, I feel like that's probably pretty easy to do. And maybe we aren't going to cause an error that will cause harm. In the emergency department, we absolutely could. We could be not paying attention and miss an emergency. We could have a patient fall. We could make the wrong decision about a treatment plan. So it's totally possible. But how do we help people navigate this?
Well, the first thing I want to say is absolutely like he was absolutely right. And the reality is a lot of us are making mistakes throughout the day, whether we realize it or not,
Yes.
as a result of burnout. Like it is,
Yes.
that is absolutely associated with burnout, is like more medical errors, more mistakes, more falls, things like that is absolutely like a reason that everyone should care about this. Um,
Yes. As a
and
patient
I,
and as a provider.
as a, yeah, and as an organization, because they care about those numbers, affect them. Infection rates, falls, like those things factor into their bottom line. And in my experience, I've seen hospitals really focus on the direct behaviors to try to minimize falls and put up all the signs and do these things, but not address the bigger issue of everybody here is really experiencing burnout, which is a little bit of an aside. But the other piece of that was, what can we do for other providers? And I think one of the most important things that we can do is to, I think in healthcare, there is a little bit of a culture of, I don't want to use the wrong word here, but it's a little bit of a culture of like fronting about what's really, we don't, it's not a very open environment all of the time about within providers.
Yeah.
And I think just starting to talk about how we are feeling about different situations. And it's not like we have to totally trauma dump on each other or try to make a group therapy session, but just being a little bit more transparent and honest about, I'm really struggling emotionally after seeing that patient. And maybe even saying, I need to take a minute, I'll be right back. Normalizing the fact that we are all going through a challenging and exhausting at times experience, so that people don't feel so alone with it, because burnout can be incredibly isolating, and we can
Sure.
really perceive sometimes that we're the ones that aren't handling it and that other people around us are doing okay or are doing better than us. And that's just like a culture of not being fully honest and transparent that is, I think, encouraged and becomes normalized in healthcare. So I honestly think that one of the best things that we can do for each other is to be more honest about our own experience and talking about patients in a way of, this is where I'm struggling with them from an interpersonal level, or from the level of, I really think that this is what they need and I'm not sure what else I can do here. Start like having those conversations and bringing those struggles that we have out into the open can be really supportive for other people who are feeling alone, and again, like they are the problem.
Yeah. I really like that. I think one thing I would like to ask us collectively, maybe as physical therapists, especially those of us who are a little crusty, is to stop with this whole just you wait. Oh, you think it's bad now, just wait till you've been doing this for 20 years. Or, oh, you can't handle it now and you're 3 years out of school, just you wait. If we could like collectively sign an agreement that we are not going to actively accelerate the process of burnout for our colleagues, I think that would be great. This whole like hopelessness, this resignation, this, it's always been like this, it's always gonna be like that. Nothing you can do is gonna change it. If we could stop stomping out other people's spark, their joy, their hope for the profession, their willingness to try and change it, and shame them when they do come to us and say, gosh, I am starting to feel a little burned out, or is this the way it's gonna be forever? And I've also seen people on Instagram or Facebook saying, I had a student who was shadowing me, but I told them not to go into the field at all because it's so terrible. Can we stop that?
Yeah. I have said in posts before, read research about human behavior and human motivation, like shame and fear are not
Yes.
good motivators. And it's,
No.
if nothing else, it's extremely unhelpful. You say that to a student, they're probably still going to go in the field, right? Because they've done all this work. Now they
Yes.
just feel worse about it. And
Yeah.
I don't think there's anything wrong. And in fact, I encourage CIs to be honest with their students, again, bringing some transparency to the areas of the field that they struggle with. But telling someone, like you said, stomping out their flame and saying, don't you, like the assumption that they can't handle it because you are having trouble handling it, that's really not helpful, and it's not your place either.
No, and it's just so common, and I understand. And some of the research I've done about burnout, specifically in physical therapists, said that it was a study from Canada, and the therapists were surveyed there, like one of their primary complaints or contributing factors to burnout was this fear about the future of the profession and the direction the profession was going and that uncertainty. So I think when we think about institutional factors and factors outside our control, like when we look at the way healthcare is going, the direction that the field of physical therapy is going, I can understand some uncertainty and some fear around that. But my perspective on that is let's take that future back. And what can we do to be innovative, to have the field we want to have, to see it to where we want it to go, and stop with the this is what it is. Nobody can change that. And so that's why I think I talk a lot about top of scope practice and like getting out of how it's always been and thinking of new ways to do it, because I do agree that physical therapy, the way that it is now, may not be sustainable. There are so many barriers, there's so many boxes, there's so many limitations, and I understand how that feels limiting and how that can contribute to burnout. But I feel like one way to combat that is to imagine what would the career and the field be like if you could change it.
Absolutely. I think you're a great example of kind of heading this movement of bringing PTs into the emergency department. That is real, that is tangible, that is something that you are doing as an active agent in this field. And I think that that is what people need to remember, is that you have agency as a provider in this
Yes.
field. And I want to validate that it will at times feel very suffocating and feel very hopeless, even because it's because the change is not going to come quick or easy at all.
Probably not.
And yeah, I was going to say it might not come in your career, it might not come at all, but you have. So what are we going to do with that? Cynicism is the primary component of burnout. You have exhaustion, you have the feelings of inefficacy, and cynicism is really the biggest predictor of having a burnout experience. And I think it requires like some courage and also some willingness to be open to creativity. And as you said, imagining other possibilities, to reject the lens of cynicism, as tempting as it may be, and frankly, as justified as it may be to have that lens, realizing that ultimately it's not serving your well-being, it's not serving your patients. And so again, it's even if we are not going to see the level of change that we want to see in the immediate future, if you're passionate about healthcare, if you're passionate about your patients and seeing them have better lives and better health and better opportunities, you want to be on the side of pushing it in that direction.
So what I hear you say is that my unhinged, unrealistic, perpetual optimism is a gift.
It's a gift. It's a gift. And you know what? There is no risk of burnout if that's how you
I'm gonna tell my husband that the next time I have an insane idea and he's that is never gonna work. I'm gonna be like, "Ah, at least I won't get burned out."
Yeah. Yeah.
Okay, that makes me feel a little bit better. It's people tell me that I'm like unreasonable and optimistic when I shouldn't be because of institutional factors, societal factors, and I get all of that. I get that, but I also get that I can only control what I can control. And this is one of those things that I can control. And one of the strategies I've used personally for burnout was professional development planning. And I've done another episode on that if anybody's interested in that, and how you can use that as a tool to take agency of your career and move forward. And out of that, for me, what I did was like create a vision around how I wanted my career to be. And I feel like I've finally, after working on that for some time, become the mistress of my own destiny, right? Like I teach part-time, I see patients part-time, I do things like this part-time, I serve my profession through the APTA part-time, and I mom full-time, right? So for me, that variety helps me. That choice about what I'm going to do next week helps me, and it allows me to really feel more in control And that, as you, one of the things you alluded to was having somebody right above you who's making decisions for you or telling you how to practice or what you can and can't do. I realized I couldn't do that so much anymore and that I needed to do things in my unhinged, eternally optimistic way. So, what are some other immediately actionable things that people can do if they don't have the same flexibility that I do? Because I realize that's a huge privilege to be able to cobble all these things together for a career, especially if you're starting out and you've got student loan debt on top of you and all of that. What are some small things people could do to take control?
Yeah, I think that one of the first things is to get really clear and specific about things that you can control and things that you cannot control within your work,
Yes.
because we can really run into struggle and exhaustion in our day when we are just trying to control everything a little
Yeah.
bit, and then really not maximizing the things that we can control and wasting energy or effort on these things that are really truly unfortunately outside of our control. I think that is a big thing, is make a list, write it down, get super, super clear on that. And then another thing I would say is just to start to be open and aware of what you do enjoy about your work or what aspects of it resonate with you. If you have had multiple jobs, reflecting on like what aspect of this did I like? What aspect of the where I am right now is working for me? And starting to try to tease that out, because to your point, like you have discovered what works for you and you like the variety, you like having that control. Some people don't like that. And some people
Yep.
like routine and they like having someone who's giving them a little bit more structure. But you have to know that about yourself in order to start to make moves that are going to be supportive. Because what I see more often is people ping ponging or pinballing around into different jobs and just being like, I don't like, this doesn't work for me at all.
Yes.
And it can be this all or nothing approach, or just again this idea that there's just something wrong with me, that I like can't be in healthcare, so I just have to leave.
Yeah.
There's so many different ways to be in this field. There's so many different ways to be an agent of change in this field. And it doesn't necessarily have to look like what someone else is doing or the way that you see other people making changes. And I think just starting to focus on your experience and what actually lights you up, what actually doesn't work for you about your situation. Like for me, you doing this account and creating content has been a source of creativity for me that I felt like, or variety for me that I felt like I was lacking in my days of consistently seeing patients. And yeah, I think getting to a point where you really feel like you have control in your career is a process. It's not going to happen overnight, but starting to get a little bit clearer about what you might be looking to create for yourself is a solid place to start.
I love that. I think one of the best things a mentor of mine said to me is physical therapy is that which a physical therapist does. So you don't necessarily need to be seeing patients. You don't need to be in the trenches all the time either to still make a difference and use that degree that you got. You can help people on all kinds of scales. So one thing that I think about often is there was a time when all I wanted to do was become a physical therapist. And I bet you remember that too. Was all you wanted to do, was all you were working towards. You went to college and you worked on your grades and you did the GRE and you did your shadowing and you went to PT school and it was so hard, but it was so cool. And you went out on your clinicals and you're like, okay. And then all of a sudden that day was there and you were a PT. And then somewhere like that joy got lost.
Yeah.
So I love what you said about figuring out what it is about the profession. Like, why are you here? So one of the things I ask people when they're doing professional development planning, why are you here? Why did you choose this job? And creating that vision for my career helped me know what to say yes to and know what to say no to also, because I didn't want to ping pong and I had been ping ponging. And I think part of ping ponging sometimes can be imposter syndrome. And like what you said, like you don't feel like you belong. And when we can create spaces that are us, that we belong in, I think that helps just tremendously. But when people are trying bouncing place to place but haven't really found what they're looking for, I think that can just make the burnout worse a little bit, can't it? Because then they really feel like maybe the field is not for them.
I think it can, on one hand, I want to say, I think it can go either way. Some people will stay in jobs way too long that are
Word.
not working for them
Yes, I've done it.
and can really feel like it's a failure to leave. I think
Yes.
so. There's one piece of this that like it is not a failure to leave a job. It is not a
Nope.
failure to leave patient care. That does not mean that you wasted your time. That is yeah. So I think that is a piece of it too. And I also think that if you're doing that bouncing effect, looking for the green grass or for the perfect situation, you might find it. But it's the problems that we have in our field for the most part permeate our field because you can't step out. It's not just organizational things, it's also like societal things. It's the way
Yes.
that that we have learned to interact with healthcare, the way we've learned to interact with our bodies. Like there's layers to burnout that we can't step out of no matter what part of the field we are in and whether we're seeing patients or not. And I think that I would say just having a level of intention or having a plan as you go into this job of how am I going to approach this, or what mindset am I bringing in, or what strategies am I bringing into this job that are going to create hopefully a different outcome for me, or at least that I'm going to learn something about myself and what I want to be doing that is going to help me then move forward, rather than just leaving, starting somewhere else, and being thrown back into this place where you again feel like you don't really have control.
I love that. I want to ask you about one more thing before we wrap it up because this happened to me too. But one of the things that you told me was that you were reprimanded more than once in PT school for how you communicate with patients and in the classroom. And I was told by one of my first employers that maybe someday, somewhere, I might be a good physical therapist if I could find a way to fit in and just be better. So I'm interested into like how that experience shaped you and what advice you would give to other people who've gotten that kind of gross unhelpful feedback.
Yeah. So what I will say is that's horrible. That's such a horrible thing to say. And again, just utterly unhelpful. That did not help you grow. That did not give you something to work on at all.
Oh, I still have
Um,
days where I'm like, maybe someday I'll be a good physical therapist.
we're still waiting. No, I think my situation, it was not about how I was talking to patients. It was about it was in the classroom, and then it was with my CI, or like in our professional relationship. And honestly, in reflecting back, I was communicating incredibly poorly. And I was young, obviously. It was in PT school, a little immature. And yeah, so I got some feedback that the way I was acting was really unprofessional. And a lot of the way that I was acting was a reaction to my perception of being treated poorly as a student, or in an environment that wasn't very supportive of students, or reacting to what I was perceiving as like values that I didn't really agree with at times in the classroom, of like professionalism, and what are we calling professionalism, and why is this our focus when there's these other things that we're not addressing that feel more important to my ability to function well as a PT. And so I think the advice that I would give to someone who is receiving some feedback in that vicinity, and again, I don't know how close our situations were, adjacent perhaps, but I will own that I was not that I was not communicating professionally in my situation. But I think regardless, it's number one that it is a that feedback from everyone is not valuable feedback. And I think that is always important to consider. I think the other piece of that is that there is opportunity for growth within your communication, within your professional relationships. I think like I again something I say a lot is like soft skills are skills. So if you feel
Yes.
like you are really struggling with the interpersonal aspects of being in healthcare, not just with patients, but with other providers, with supervisors or administrators, et cetera, like that is a potential area of growth, and you are not necessarily resigned to being in like constant conflict or constantly being the odd person out. Or you might be the odd person out, but you're going to, with the skill set, you can feel a lot more confident again on the ground that you're standing on. And if you can be a better advocate and a more effective advocate for yourself, for your patients, for whoever it is you are speaking up for.
I love that. I so much appreciate you being on the show. Just before you go, tell people where they can find you, how they can find you, and what your top of scope takeaway is.
So you can find me on Instagram at Meredith Grossman PT. And you said my top of scope takeaway.
Top of scope takeaway.
My top of scope takeaway is that I think I speak a lot about communication in my work and on Instagram. And I think that and because of that, I'm biased towards it. But I think that if you are looking to elevate the scope of your practice or to really hit a higher level of expertise and of effectiveness in your practice, I have found that communication skills and working on communication and experimenting with it and playing with it in the clinic can be a really engaging process and a really empowering process in helping me to not even just professionally but personally. They are skills, and they are things that can really, especially if you feel like you're hitting different certifications or going to different courses and you feel like your practice isn't really developing, that is one place, that is one area where I have personally seen a lot of growth in my own practice.
I love that. Thank you so much for being on the show. Please check out Dr. Grossman's work. And also, just a little plug, we have updated our website. You can find a lot more continuing education opportunities for the rest of this year. And thank you for listening.
All
You
right, thanks
have
for
been
having me
in the
on.
ED now, and you're officially discharged.